Hello everyone, my name is John Morrone, one of the partners at Levitt, and this is Jonathan Levitt, one of the founding partners at Levitt, and we're going to speak today on telemedicine and COVID-19 and how telemedicine can help fight the spread of COVID-19.
So John, the COVID-19 pandemic has impacted the global economy. In the United States, it's hit all sectors of the economy. It's hit healthcare and life sciences in particular ways. Within each of those segments, healthcare and life sciences, it seems like our client base, whether it's a retail pharmacy, specialty pharmacy, hospital and pharmacy, on the healthcare side, a physician practice, an oncology practice, ambulatory surgery center, they're all impacted differently. It seems like the amount of delta, if you will, that a practice is experiencing has a lot to do with the amount of foot traffic. How does telemedicine interact with COVID-19 currently?
So traditionally, most of healthcare was delivered in a face-to-face encounter. Patients went to a physician's office and saw the physician or went to the hospital. Telemedicine has been around and has been viewed as the future of healthcare, but there were a number of obstacles. So telehealth is really an encounter via an electronic medium that provides an audio and visual connection with the physician and patient. Some of the obstacles, though, that had been in the way of doing this were certain HIPAA rules, reimbursement rules, and some anti-kickback rules. Recently, within the last week, the federal government has lifted a number of these rules. So the Office of the Inspector General, for example, has allowed waiver of co-payment and patient responsibility for Medicare beneficiaries and all federal health care payers, where historically that would have been viewed as a kickback.
Does that include state Medicaids as well?
It does include state Medicaids as well, and some commercial payers have followed that lead and are waiving co-pay and patient responsibility for telehealth encounters. Another significant change has been via the HIPAA, which most providers are familiar with, is that the technology that was previously required had to be HIPAA compliant. That rule has been relaxed so that providers can now use a medium like FaceTime, as long as it's forward-facing and not public, to connect the physician or other provider to the patient. The other change that has occurred is in reimbursement. Historically, Medicare would not pay for a telehealth encounter when the patient was in their home. That recently has been changed so that patients can receive telehealth services at home. So this provides greater access to Medicare beneficiaries and other healthcare providers. And just looking at it within the confines of COVID-19, we're seeing more and more municipalities, government agencies, advising people to stay home. This allows patients to connect with their physician, continue their treatment via telemedicine. And those encounters are the same as a face-to-face encounter, and most states have parity laws which require insurance companies to compensate the physician for that encounter as if the patient had come in face-to-face. So it really is somewhat of a panacea when it comes to COVID-19 and the ability for physicians and patients to connect via telemedicine.
And interestingly, John, when it comes to these parity laws, where it's just typically state laws that say that the insurance company has to pay the same for a telemedicine encounter as a face-to-face visit, in our experience on the litigation group, many insurance companies are not following those rules, and I would urge providers who are trying to stop the spread of COVID and trying to make use of telemedicine to counsel competent healthcare lawyers to fight the insurance companies not following the parity laws.